Hi Jessica, thank you for coming to see me in the anaesthetic clinic today. I understand you've got surgery coming up.
Yes, in a week.
Right, okay. And doctors provided you with some nicotine replacement therapy previously. How are you going with that leading up to surgery?
Look, to be honest, it has been hard, very hard. And I have found that just with the patches, wearing those overnight, I have had some quite vivid dreams, just sort of unsettled sleep. I also feel as though the spray, it's an awful taste. And there's been, I guess, a couple of moments in the last week where I've relapsed and had a cigarette here or there and feel, pretty bad about that. It's only a week away and the stress is building, so I just don't know, to be honest, how I'm going to sort of make it. I'm feeling quite anxious about it.
Yeah, look, you've certainly sound like you've made some effort to decrease the number of cigarettes you've been smoking, which is fantastic.
Yeah,
so
absolutely.
You should be proud of yourself for that. Do you understand the importance of quitting smoking prior to having an anaesthetic and having major surgery?
Yeah, I mean, I do. It's just really hard.
Yeah, and look, I acknowledge that it's really hard, but I guess we need you to know that, when you have an anaesthetic, we need your lungs to be as healthy as they can, and also quitting smoking can also have an impact on how your wound heals after surgery as well. So it is really important for you to, keep trying, and we understand that it is very difficult. You said you were having quite vivid dreams. Have you been wearing the patch overnight?
Yes, I have been.
Yeah. Okay, and have you been changing the patch at the same time every day?
I have, yeah.
Excellent. Yeah, the other option is that perhaps only wear the patch for 12 hours of the day, so maybe putting it on at 8 o'clock in the morning and then taking it off at 8 p.m, so you don't have that higher dosage of nicotine overnight when you wouldn't generally be smoking anyway.
Okay.
Yep.
So yeah,
you could give that a try.
Good.
Yep.
Yeah.
The other option in relation to not liking the taste of the spray is perhaps you could change that and have either the gum or the lozenges that may have a little bit of a better taste rather than the spray for when you have those extra urges.
Okay, so what's the gum?
So there's like a nicotine replacement gum, so you can just, like a chewing gum that you chew at the same time when you would have taken the spray when you have those urges, that you could perhaps try.
Okay.
Yep. Yeah, look, and I understand leading up to surgery that it's certainly a very stressful time, not just in relation to quitting smoking. Do you have support around you? Have you contacted the Quit line?
I have contacted them once and had a fairly brief conversation, but I don't think they sort of understood, I guess, the whole picture and the seriousness of me going into surgery. So it wasn't as helpful as I'd hoped. So I guess I'm just feeling like, well, the stress isn't going to decrease and it's only a week away, and I really want to, just try and be as healthy as I can.
Yeah, well,
like we agreed.
Yeah, so that's great, and thank you for making the effort. Certainly, you could reconnect with the Quit line and have a chat to them about the fact that you do have surgery coming up, and that obviously that has increased the stress, not only in relation to that, but around the quit attempt. Do you have any friends that would also be able to support you?
I have had a very supportive friend, which is great, who I reached out to after our last, conversation, and she's been, encouraging me to stick with it and stay with the patches and just get through it. So that's been helpful, yes.
Oh, that's great.